At about the same time that testosterone was being introduced as a therapy for andropause, Charles Huggins, shown here at the University of Chicago, showed that men with advanced prostate cancer could actually have their disease put into remission by eliminating testosterone. For this work, another Nobel Prize was awarded. But what about the flip side of this? What happens to the prostate when men are given replacement therapy or exogenous testosterone? Actually, in men with advanced prostate cancer, a little bit of information is available, and clearly giving testosterone to men with advanced prostate cancer is detrimental. This kind of work was done in various clinical trials here in New York at Memorial Sloan Kettering in gents like this with metastatic bone disease. The results are generally unfavorable. Of 52 men gathered over several decades, years ago, when these men received testosterone, pain increased, nausea and vomiting increased, metastases increased, there were even deaths. So clearly it's contraindicated in advanced prostate cancer. In fact, the director of the National Cancer Institute, Andrew von Eschenbach, America's #1 cancer doctor, told the New York Times recently, recognizing the dependency of prostate cancer on testosterone, "I am not convinced there's enough evidence on its safety to justify widespread use." To help determine just what testosterone does to the prostate, we designed our clinical trial. Our hypothesis was simply that exogenous testosterone enters the prostate, is converted there to dihydrotestosterone, the active metabolite within the gland, and affects biological change there. We thought it remarkable that even in the early years of the 21st century, basic information like this was not available. Our study participants were older men with low testosterone levels, symptoms referable to low testosterone levels, and no prostate cancer on a screening biopsy with PSAs less than 10. We didn't want to risk giving this to anyone with cancer at this early stage. The trial was a randomized trial of 6 months duration, and all men in this trial underwent biopsy at baseline. This was the unique aspects of this study, was that we studied prostate tissues directly, while others before us had studied gross measures of the prostate like changes in size or indirect measures such as serum PSA levels. Thus, all men had biopsy at baseline and then were randomized to receive either testosterone replacement therapy or placebo for 6 months, and then underwent rebiopsy at the end of the study. The first thing we found in these 41 men who completed the trial was that cancer was not increased at the microscopic level. 2 cancers were found on biopsy in this group at conclusion, that's the testosterone-treated men, and 4 in the placebo group. So actually, more men from placebo were found to have cancer than in the than in the testosterone group. So clearly, this medicine, the testosterone replacement therapy, was not stimulating the development of new cancers, and these cancers were approximately equal in severity in the 2 groups. It's also interesting to realize, very likely, these 6 cancers were there from the beginning.